Welcome team. In this video, we are diving into a crucial global health decisions. United States of America has officially withdrawn from the World Health Organization under President Donald Trump's administration. On 20th January 2025, President Trump signed an executive order initiating the withdrawal process, which is expected to take 1 year to complete.
As part of his blitz of executive orders issued yesterday, President Trump also delivered on a campaign promise to withdraw the United States from the World Health Organization.
So, in this analysis, what are the implications, advantages, and challenges of this move, and also what are the hidden secrets behind the facts? Let us discuss. Everybody must know what is World Health Organization, WHO. What is that? It is a specialized agency of the United Nations, which is responsible for the international public health. It coordinates global efforts to combat diseases, improve healthcare systems, and promote health research, guidelines, and distribute vaccines. Specialized agency of the United Nations, which is responsible for international public health. It coordinates global efforts to combat diseases, to improve healthcare systems, and promote health research, guidelines, and also distribute vaccines. Have to highlight the world distributing vaccines all around the world. So WHO, World Health Organization, has been instrumental in controlling diseases, like polio, providing emergency relief during health crisis, even pandemic. So key contributions and examples: disease control prevention led the global fight against COVID-19, providing guidelines, distributing vaccines all around the world. So eradicated smallpox and continuous work on polio eliminations. Now we discuss about the title Health Research and Guidelines, developing health standards such as safe water consumption and food practices. They used to publish the World Health Report to track health trends. So what about emergency response? Yes, they provide emergency support for sudden disease outbreaks, natural disasters, even a health crisis. Example, response during Ebola outbreak in West Africa. You can read it in Google. How it is possible or all around the world. It's not an easy task. So strengthening healthcare system in developing countries, like conducting workshops, training, coaching health workers, and funding infrastructure projects. Funding is very important. You know what? Regarding health advocacy, promoting campaign for mental health awareness, vaccination programs, and lifestyle disease prevention. World Health Organization's role is crucial in fostering cooperation and ensuring better health outcomes worldwide. Now we move to what are the USA's contributions to World's Health Organizations. United States of America has historically contributed around 15% to 22% of World Health Organization's budget. Funding programs for polio, tuberculosis, malaria, even HIV/AIDS. This financial support has been very important role for disease eradication efforts globally. So you may think, why are we discussing this topic now? Because we are not from America. We are from Asia, Africa, Middle East, and so on, apart from America, right? When this video going to end, you'll come to know why we are discussing and how it is important to discuss this topic. Donald Trump justified the move by accusing World Health Organizations regarding three criteria. Number one, bias toward China. Number two, corruption. Number three, inefficiency, particularly regarding COVID-19 pandemic, the way they handled. So President Donald Trump, he criticized the United States significant financial contributions compared to other nations, like there's so many members are there for World Health Organizations. So why did the United States withdraw from World Health Organizations under President Trump administration? President Trump announced the withdrawal from WHO in 2020 actually for several reasons. For example, handling COVID-19 issues, transparency concerns, even a financial burden to United States, reform demands. You know what? President Trump criticized the World Health Organizations for allegedly being biased toward the country, the competitor, China, and its mishandling the initial outbreak of COVID 19. Regarding the transparency concerns, accusations that the World Health Organization they failed to provide accurate and timely information during the pandemic. When we get to know the financial burden of United States of America, it's more interesting. I'll tell you later, but the small concept I would like to discuss with you here that United States contributed the highest funding to World Health Organizations when compared to other countries. President Trump argued that it was unfair for American taxpayers to bear the bulk of the costs while other nations paid less when compared to United States. Okay, so what are the reformation demands? President Trump administration demanded significant structural reforms within the World Health Organizations that claiming inefficiency and political influence. Shortly, we can discuss what are the advantages and disadvantages. There are pros and cons to this decision. On the positive side, it could save costs and give the United States more control over its health policies. It weakens global health cooperation and it makes the United States more vulnerable to health crises and reduces American leadership in global health diplomacy. What are the hypotheses of our analysis? And is there any brilliant solution for this? Yes. Experts, experts from biological department, management department, human resource department, they are disclose their warnings because it could lead to delays in addressing health emergencies, man. Instead of withdrawing, United States could push reformation, tie funding to performance metrics. You can form public-private partnerships. Despite criticism, President Trump insists the United States is being unfairly burdened by contributing significantly more financially compared to other nations. Behind the fact, President Donald Trump could create a season to silence the world. Mark the word, make you silent. Okay? Don't talk, make you silent to the whole world. It's like a kind of an announcement. Smart move. Okay, there's a potential for unrelated investments. Point number one. Okay, global influence strategies. It's a point number two. Distraction through controversy. It's a strategy. Point number three. Okay, you got it right. Distracting others through controversy, because it's a trendy news right now. Unrelated investments. What's unrelated investments? Redirecting funds to other sectors like military or private industries rather than healthcare or intellectual development. This aligns with concerns about funds being wasted, man, on war weaponry rather than productive ventures. Global influencing strategies, what is that? America First. The title doctrine may lead to attempts to weaken global institutions like World Health Organizations or NATO or something, and limit cooperation, which could isolate certain global voices. If you raise your voice, they have a strategy to make you down, to shut your mouth, man. It's a brilliant idea. So, how to distract others through controversy? President Donald Trump thrives on creating controversy and confusion among the media. Medias are the biggest support to make this happen. Focusing attention to polarizing issues may overshadow constructive global discussions. They are the people who construct everything over that. So, our hypothesis based on this issue, if the United States withdraws from World Health Organization, global health system will experience delays in addressing the health emergencies. So sad. It's a very sad thing. Potentially increasing the risk of pandemics, hampering disease eradication efforts. So conversely, the United States may prioritize domestic health infrastructure, but at the cost of weakened international influence. Thank you. I'm done, team. If you have anything to say, put in comment. Criticism, most welcome.